Good afternoon for the audiences around Asia and those. I think we have participants, audience from Africa also. So very pleased to that you can participate. On behalf of the co-organizer, the statesman, a leading Indian media and founding member of Asia News Network. Asia News Network is an alliance of 23 national media in 20 Asian countries. We are about 20 years old, and we are active around Asia, and even we used to have a temporary office in Delhi, and we have held several meetings in Delhi and in Calcutta, where the station is based. Have met a few of your prime minister, several ministers, and visited many cities. So I'm very pleased that we are back here to look forward to the end of the pandemic. And also thank you for Data Lead, a health analytic multimedia platform based in Delhi that assisted us and co-hosting this webinar. I am a co-moderator, Akansha Rathore from the Statesman, would like to welcome you to this webinar, Indians, Vaccine and Vaccination. It's not mission impossible, but mission possible, that we are seeing recovery in the economy, in the falling cases, COVID cases and death rate. India is now has vaccinated with 1 doses almost 900 million people. It's a monumental task, and I hope today that we can learn a lot from the Indian experience. And many, I think, participants are health authorities from the COVID country, Bangladesh, Myanmar, Nepal are among countries that heavily relies and waiting for vaccine from India, and we hope that the export will be lifted soon to help all these countries. We regret that Mr. Vikas Chiu, the additional Secretary of Ministry of Health and Family Welfare, has to abruptly cancel because of emergencies. But our panelists today are very qualified and distinguished, and we'll be able to answer all the questions that all of us has. If you have questions, please post them on the Q&A or raise your hands, and we will come to you as we move along. Maybe first I could introduce Mr. Pratyaya Amrit, who is Additional Chief Secretary, Health Department of the Government of Bihar. He has been leading the health system, delivering medical and public health services to 120 million people. Is a large state, and would be the one of the largest Asian country on its own. So I'm sure we can learn a lot from the activities there. And Mr. Amrit is I understand also very innovative both on the technology and in state management. So I'm very pleased to have you here this afternoon. Next, Dr. Rodrigo Offrin, who is the WHO India representative. I understand you are Filipino. Welcome. Okay. And Dr. Offrin comes from with a rich experience of 2 decades of public health, mostly with WHO in Southeast Asia. He has been involved in drafting programs or related to emergencies, has been involved in several of the emergency in disaster, like the Nargis typhoon in Myanmar, which is a big event, the tsunami and so on. So it's very well qualified and to help us to see the perspective where other countries can learn from the Indian experience. Last but not least is Syed Nasarat, is an award-winning Indian journalist, media entrepreneur, and founder of Data Lead. Data Lead has been tracking health activities for years, even before the COVID. And I think we are pleased that he will be able to analyze and give us the perspective on India compared to other countries, and how the society is coping, mentally and in the communication, the state communication, which is important in the management of COVID. May I first start with Mr. Amrit? Perhaps you could sum up some strategic direction that was formulated and has evolved over time, whether it's related Bihar or at the national level. Please, Mr. Amrit. May I can give you microphone to you. Please go ahead. Mr. Amrit, can you hear me?
Sorry, I think there is some issue with the audio.
Okay, we can hear you. We can hear you. Please go ahead. Is it working?
Yes, absolutely fine. It's
yes.
Fine now.
Okay. Yes. Okay. Please go ahead. Yes, please go. Yeah.
You should repeat the question.
Yes. For Mr. Amrit, perhaps you can sum up the strategy that at national level, at state level, and what how it has evolved over time and where you are now. Please go ahead.
Yeah, thank you very much. And personally, it's a great pleasure for me to be here on this platform and to share our experiences, how India has fought with this pandemic, and how it is one of the best example of cooperative federalism. You see, for any challenge or any reform to succeed, we have always believed in two aspects. One, the vision of the political leadership, and second is the implementation by a committed bureaucracy. Now, this vaccination campaign, this is one of the best example of this. If you see it at the center level or at the provincial level, it is being led by the political leaders, and it is being implemented very effectively by the administrative officers along with their team. Now, a size and shape of a country like India, where you have so many provinces, heterogeneity is there, challenges are huge. I mean, it was still not a very easy task, but all I can tell you is determination and teamwork. Whether it was, the planning when it comes to making these vaccines available at the right time. That was the first decision which was taken by Government of India, and it was taken at a time when many of the countries had not even thought of that. So the planning of having a Covishield or a Covaxin. And second stage was after the COVID phase 1, I've been part of this journey. We realized that in January 2021, this year, it was a very systematic approach by the Government of India at the central level. We all were aware about the shortage of the vaccines, because overnight you can't produce vaccines. So therefore, it was a very slow, staggered approach. And in that approach, what the Government of India did was, we went phase-wise. First and foremost, the most important people who are the forerunners, who are the fighters, are the healthcare workers. So the first decision of Government of India was, let's vaccinate all healthcare workers in a record time. Now that process started, and I still remember here, we were the first ones. In fact, I was the first one to take the first shot myself, because that degree of hesitancy was already prevalent amongst the healthcare workers also. So I was the first one to be vaccinated. And believe me, the news spread like wildfire. And very soon, most of our healthcare workers, were also getting their first shots. Then Government of India added another category, the front line workers. Now, what is the meaning of front line workers? The people who are directly, like the police administration, the disaster management people, the urban development, the officials. So all these people were categorized into the frontline workers. Then with the availability of doses, the second stage was for frontline workers. And that's how India did it. We went first with healthcare workers, then frontline. When it came to general public at large, we were aware about the hesitancy. Second, and very important, the availability. So we had to use it to the best and maximum in the shortest possible time. So we did not open it for everybody. We started very gradually, 45 plus with comorbidities. It was open for all. So every stage was very well thought of, very well conceived. And I must tell you, this is one of the best success story where the center and we are conducting implementing this entire experiment. We are working at the province level. We have had very good, fruitful interactions at regular interval. The Honorable Prime Minister met the Honorable Chief Ministers through video conferencing. He kept briefing them. He took the feedback, and that's how it is being implemented in the country. So keeping this in background, when we were hit by COVID second phase, which was, as you would be aware, the variant, the mutated form, the entire country was hit very hard, and so were we. We were one of the worst affected state also, and country passed through a terrible time, and we all had to put up our best foot forward, huge teamwork, and finally we were able to overcome that crisis. And at this stage, certainly I would like to thank all the development partners, including WHO, UNICEF, all these people who were very liberal, and we got a lot of support from these people. Now, what second stage taught us? We saw some results which a lot of people were not sure about. And to be very candid, that included some of the healthcare workers. What we found out when we saw the casualties, we realized that the healthcare workers or the frontline workers who were given double doses or even single dose, the casualties were far less. Now, seeing is believing. Once we saw this, and then we knew that two potential weapons which are going to be affected if at all a corona third wave comes. We are all geared up. We are preparing ourselves for that case also. One is regular testing. Second is vaccination. Only these two weapons are there if we have to fight the possible corona third surge again in the country or in the world for that matter. So the entire country today is testing per day in Bihar, from where I'm talking. We are doing a lot of testing per day, and vaccination, we have gone into a mission mode. Now, in last few months, what has happened? Our production has ramped up. The Government of India has ensured that we have adequate now number of doses. Now, these states are being given good amount of doses. We are able to plan it well. And the net result is that today, as you have rightly mentioned, like in Bihar, for instance, on 21st of June, the Honorable Chief Minister launched a mission mode campaign, 60 million adults in 6 months. And that 6 month is 31st December is the upper limit. I'm happy to share today when I'm talking to you, we have already crossed 50 million. So that's the way we are approaching the task. So now we have available, the doses are, we have with us. That is no more a challenge. Second, people have seen the result. So overall combined, today the country is progressing very well. And let me again tell you one more thing. Every 5th day or 6th day, we have an interaction with Government of India where our issues are also discussed. And that's how it's a perfect example of cooperative federalism.
Before I come to Dr. Offrin, maybe just a follow-up question with Mr. Amrit. Could you have prevented, if you look back, that first explosion of cases and death at that time? Would that be preventable, or it was part of the wave that was a natural occurrence?
To be very candid, this time the way, even the first time when Corona came, I mean, the entire world was taken aback. See, notwithstanding the fact that we used to get some news about China, but I think the way the first wave hit the world, and it taught us many things. The best of countries in the world were not prepared for this. I mean, it was a huge challenge for the humanity, and never before, any country had witnessed, at least in our generation. People started comparing it with Spanish flu, and so many other examples started coming. So in the first wave also, India, the way we clamped down, the entire country, the way the entire movement was clamped down, the first wave was, tackled at least partially because of our lockdown method. Most of the states were in that lockdown mode. A lot of people mask even today. I mean, people, are getting used to it. I'll be very candid. Despite all the vaccinations, we are day in, day out communicating, social media, we are telling people that the war is not yet over. Even if you are vaccinated, for God's sake, use the mask, maintain social distance, and we have to practice the hygiene, keep washing hands regularly. These things, were not there when it came first time. So it has evolved, this journey, but we have learned it very fast, very quickly. So to say we could have prevented deaths, I will not, exactly agree to this. The government, and I'm sure everywhere, every government did its best to combat this. And, the goal of, I'm sure every government was in the world, how quickly, to help the people, because like shortage of oxygen, this was something unprecedented. We faced this. When I was watching the news, I saw Bangladesh going through this phase, Thailand going through this phase. I think, everyone. So it was again unprecedented. Now, having seen the two waves, we have our preparations, our hospitals. Now we have the gas pipelines. We have the oxygen cylinders in place. We have these plants installed. We have pressure swing adsorption plants. So, this pandemic has taught the world that health infrastructure is one area which needs a lot of investment and a lot of commitment.
Thank you. Thank you. Dr. Offrin, maybe may I come to you? If we look at the Asian and African countries, African in particular, where the vaccination is very low and the health system may be not up to the standard, what lesson can we learn? We all learn from the Indian experience, both the pro and the cons.
I think, well, thank you very much first for the invitation, and I'm very happy to be here with the additional Chief Secretary of Bihar and Syed. And of course, first is just to echo what the additional Chief Secretary has just said. He's being modest because on September 17, Bihar was the top placer for the vaccination all over India, 3.3 million in one day. And that time, the country had 25 million doses delivered. Just put it into scale, that's population of another country. So when in India, you work to scale. You don't scale up to work. You have to think that what you are doing is able to scale. Is to the scale of the population, its diversity, etc. The other point is that what India does is of global importance. So that's key. And that is possibly why we're all together right now, trying to learn from the lessons of this vaccination campaign. Well, to your question, I think the first point is that India has a very good system for mass vaccination. Its routine immunization system is key. And so the plan was not to reinvent something. You strengthen what you have. Locally, it's known as Mission Indradhanush, that scale up for vaccination. And that's the infrastructure that was used. Okay, so that's the first point. And from there, you innovate.
Can I just ask here if you can explain this health system a little bit for those of us who don't know?
Okay, so it's a very detailed, elaborate system for routine immunization. I see smiles from everyone. It is a work of several people. Whether it is, let me just explain to you what happens. There is last Saturday there was a subnational immunization day. Okay, for Bihar, in fact, and it's a series of microplans. When we say microplan, down to the last house, who will be reached on what day for 5 days to check whether you have you're lacking a polio dose or whatever dose. Okay, so a plan is set up by district immunization officers for several districts, several blocks. It's down to the block level. So you have state, district, block, and that's how it's spanned out. And every day there is a schedule of what is to be done. Every day that plan is reviewed. What did you miss? Why? Do we have to go back to the next day to that other house? We were not able to reach a certain house, whether for whatever reason, it was raining, it was flooding. But even if it's monsoon season, rest assured there will be a boat ready. There will be a dedicated health worker that will cross that river. That's the kind of discipline of mass immunization India has. Now, with the it is recorded. You will be amazed at how these plans are recorded, how they are monitored, how they are delivered in terms of reach also. So using that as the base for the vaccination campaign, an integrated information network was also added. So you work to scale, but you innovate at this point, because at this time, the country knew, government knew that we need to be able to track what kind of vaccine you're getting, what kind of dose you are getting, when. As mentioned, the first goal was to prioritize. So it's healthcare workers, other frontline workers, and those 60 and above who are difficult to reach. So as of today, as I speak, it's now around 900 million vaccine doses delivered. And I think for all these priority populations, you are already at, well, at least one dose, 99% of all healthcare workers, other frontline 100, high 80s for completion of both doses. Still need to reach more of the 60-year-olds. Because of the difficulty of mobility. Now, with that, it's important to know. I visited Bihar. I was in an area which was regularly flooded, and what did two men ask me? The younger man said, "We need our second dose of COVID vaccination." So we asked, "What did you have?" I have the 28-day. The brands were not an issue. It was when he needed it. And the older man said, "No, I have the 3 months and it's June." So this is also gives you an idea of the scale of the communication and the reach. So in India, you have a huge healthcare workforce called the ASHAs, the advocate social activists for social for health advocate, sorry. And the ANMs, they are in every village. They know who are to be vaccinated or not vaccinated yet, who are pregnant. So it's a huge system that is from the community up. And with, as mentioned, if you have policies that are well thought of and plans well thought of with a team that's able to execute and roll it out, then this kind of numbers, this kind of scale of vaccination is possible.
And maybe
maybe
I just ask follow up here. What improvement that you could envisage, if in the system itself?
Okay, so maybe it's so difficult to kind of do that judgment in terms of what to improve now, because we are now into this from a year now. I do remember it was September where we were all rushing to develop training videos. The amount of training that was done, I'll give you numbers later if you wish. More than 800,000 workers, healthcare workers that will be delivering vaccinations. We were part of the cascade training for that. Our teams in the States were part of that. So what to improve will probably it's still the reach at very grassroots level. We may be communicating in mass media, social media, but at the village, at very rural areas, there are different people being trusted for information. For the most part, 60 to 70% is still the ASHA, the basic community healthcare worker, but there are other influences for that. So that's a constant. And what I can say is that as we move, when the numbers were showing that it's very difficult to reach the 60-year-olds and above, the policy shifted to a near-to-home programming. So what was happening was you had more places where you could access your vaccines, whether it's the workplace or near a village. So that's what was going on. So it's a very agile kind of policy that and rollout that you need to happen, and this was happening for India.
Thank you. Syed, may I come to you? In the level of communication, the effectiveness, because India is not a country that is easily communicatable because of diversities and the size of the country. And what happened to the people who refuse religiously or whatever to vaccine? How are they being treated? Please.
Thank you so much, Pan. I'm really glad to be here. And I really echo what Mr. Amit and Dr. Offren said, essentially, like at the scale of this vaccination is really unprecedented. I think no other country in the world has scaled vaccination at this level so quickly. And as Dr. Offren rightly said, actually, this is an investment of last so many decades into the vaccine, actually, in the workforce and systems in place. I think the communication was really, fundamental in managing the whole crisis, because to be honest, nobody knew what was happening when it was second wave. It was devastating. People were dying. We still, the nature of the virus was still changing. There were different scientific conclusions that how virus is behaving, then the CDC's guidelines about whether to use a mask or not. There was a lot of kind of a confusion about, and think globally about the nature of virus and it is affecting. And I think that certainly made people fearful, nervous. And because we work with a team of doctors globally on a health fact-checking and health literacy project. And actually we were very clearly able to see that what people were actually typing in Google and what kind of questions they had about the COVID. Can I buy a newspaper? Is it safe to bring a newspaper home? Can I wash my vegetables 3 times a day or 4 times a day? So there was a lot of confusion around that time. And I think that was also one of the reasons that why we really had so much loss because of COVID, because there was a huge misinformation. And that also actually discouraged people to seek treatment. We saw some people actually, unfortunately, committing suicide once they got infected in other parts of the country, like the world. So I think, but then I think immediately after the second devastating, wave, I think everything somehow there was a sense that we need to put a step down and then we need to start working in a way that we effectively control this disease. And luckily for Indian story, because we had 2 major vaccines coming from the country, and there was a confidence that we can supply them quickly. And then somehow down that particular time, I'm saying immediately after the second wave, the communication was very from top down that let's go and vaccine as many people as possible. And 45, as Mr. Amrit was saying, there was a limit of having plus 45 people, then those who have different conditions and all, and then eventually then taking a final decision, let's vaccine all above 18 by the end of this year. I think we're still, and as Dr. Offren said, we're still out there vaccinating millions of people, actually almost now every day, and we still have a huge road ahead. And like if we look at numbers, I think almost 70% of eligible population is vaccinated with the first dose, which is a huge number. But I think we still have both doses are still is a long way for us to do it by the end of this year or early next year. So I think the communication played a fundamental role, and I think our challenge still remains fighting misinformation, rumors, unscientific claims about the nature of virus and about the vaccine itself. Because we saw also rumors, for example, that the pregnant woman can't take vaccines. There were a lot of social media content about it. There was a content that if you take a vaccine, it will cause infertility among you, and people were not going for it. And there were videos local, in some communities, there were local people talking about it. No, don't go for it. You may die, you may get heart attack and all. So I think globally, WHO took an amazing initiative in terms of infodemic management. They started a course in the middle of pandemic, 2 cohorts already done, and they've announced the 3rd cohort in which they're training healthcare workers how to fact check misinformation in real time. I think communication is still in the process in the next couple of months, really has to be clear, because most of misinformation circulates when there's no communication. So that's why the WHO, UNICEF, the state governments, and the center, there's a lot of focus in terms of making information available to people so that they take informed decisions.
Thank you. Mr. Amrit, may I come to you, back to you. Just before that, can I ask the audience if they have questions? Please post them on the Q&A, and we will post the question to the speakers a little bit later. Mr. Amrit, India politics and India bureaucrats are not well known for their efficiency. But what brings this together? That you mentioned that brought the two together to the maximum. Is it because of the level of the crisis, and can this be emulated on other things, or it's a one issue things that brought you both together?
I had stated earlier also, in any country, any province for that matter, my own experience of having worked almost 30 years in the service is, if you have a political leadership with vision and a bureaucracy to implement it, there is no reason why the reforms will not succeed. A pandemic is one example. We have several examples. Look at electricity, providing electricity to each and every household. This was achieved in 2 years' time in this country, and every state participated along with the center. So, it's a very generalized statement. And yes, challenges are there in this country. But, it's a great teamwork. And notwithstanding this crisis, which is still looming large, we are all prepared for the 3rd wave. And but as has been mentioned by Dr. Offren, and that we have been utilizing the rich experience of our polio vaccination team. In Africa, I believe this is going on, the polio campaign. So they can take a leaf out of this. And, this really prepared us, because I remember 8th of March, I wanted to experiment how much we can do in a single day. 8th I chose because it's an International Women's Day. And we have a very strong women group in Bihar. Self-help group Jivika, very strong, one of the biggest group in the country. So I got in touch with these people, the CEO of that organization, and I just wanted to see response. And 8th evening, we realized it was tremendous. That coupled with our polio vaccination, experience, like I'll tell you, just on September 21st, 17th, Dr. Offren has mentioned about that campaign, where we are topped in the country with 3.3 million single day. And on 2nd October is a very, very important day for our country, father of nation, Mahatma Gandhi's day. That day in Bihar, we again took this attempt for a mega vaccination drive. And it's very important. If you just leave it on a day-to-day basis, then the team gets fatigued and people start taking it very casually. So to make it more challenging, you see, after every 15, 20 days, as he was mentioning, we keep working on our micro plan, availability of the dose. We know exactly which areas to be hit. And then we announce the mega camp. And then on 2nd October, notwithstanding heavy rains all over the province, we were able to touch 3 million. I was traveling all over Bihar that day. It was pouring, but it was so nice to see women standing in the queue, and our entire team, which Dr. Afrin has mentioned, the accredited social health activists, ASHAs. We call them Asha Didis, and our ANMs, our, the entire team, our entire health family. So it's a combination of the leadership, commitment, and the larger goal is right there. If we are able to, protect country, if other countries are going to learn from us, the ultimate goal should be, let's save the world from this deadly disease.
Can I ask, I understand that the vaccine in India, some are free, some are priced at about 100 rupees or something. What's the rationale behind pricing and free availability of the vaccine?
You see, it is by and large, when it comes to government, it's free. Like in our province, it's completely free. Okay. Now, why some pricing has been done? It is just to encourage these private hospitals. See, to have this public-private partnership in this model. Therefore, a lot of people who can afford. See, I was telling you from the beginning, the question was demand and supply. So it was planned beautifully. People who can afford, people who can go to any hospital. So certain percentage, it's not all. It's certain percentage which was earmarked for the private hospitals, and a capping was also done. It was not that you could charge any amount. A capping was done. So people who could afford, they can still go today and get their shots. But government, because India primarily, as you would be knowing, it's a welfare state, and primarily our population is rural based. So keeping that in mind, all the government facilities across country is administered free of cost. And it has worked very well, because you see, in Bihar, for instance, I'll cite one example. When COVID second phase hit us, in our part, it was primarily urban areas which were hit very badly. Rural areas, whether it was first phase or second phase, it was not hit so badly, but urban areas was devastating. So our population, almost 85% population is in rural area. 15% is only in urban area, but that triggered this entire, crisis. So what we did when we had less doses, first phase of our vaccination in Bihar, we planned we will attack only the urban pockets. And that's how we achieved 100% vaccination in urban areas. Now, that sent two signals. Urban areas are magnet. People from rural areas, they keep, thronging these cities, the places, whether it's employment and other things. So they started getting the message that everybody is getting vaccinated and there is no crisis. As rightly mentioned by Syed Nazakat, he rightly mentioned all kind of things on social media against vaccines. So all combined, strategy worked beautifully.
Okay, thank you. Dr. Afrin, is India ready to lift the ban on export so that the COVID country can receive their doses? How long are we have to wait until such time?
I am not, that's not something I decide on or will be able to speak to you about, but considering how things are moving, maybe we'll see some development in that area. And maybe to connect on that question is that there is so much coordination between the Department of Science Technology, the DBT, biotechnology, the manufacturers, the Ministry of Health and Family Welfare. That is a very coordinated discussion that has been happening. It's and that's what you see in India. India is the pharmacy of the world. 70% of all vaccines, whatever disease, is produced here. So there is that capability. It's not a capacity, it's a capability that's installed to the country and its health system. So when these questions are asked, that is the thinking. It's an ecosystem of research to product. And that was very well coordinated in this vaccination campaign. Two, I think it's very, very important to point out that there is also the connection of the technical experts. The National Technical Advisory Group for Immunization advises regularly the National Expert Group for Vaccination, which sets out policies for national and state level to roll out. So these questions are come to this group. It's a fairly complex issue to say when you will not be able to lift the ban on exports, but it's a space to watch out for because the country is really pushing very well in terms of vaccinating everyone. But to point out again that it's not yet over, so still it's test, trace, treat. You test to pick up. There is early warning that's set up right now in many states so that if there is a cluster of cases that pop up, you're able to manage it right away. The testing is another amazing story. It's not just the vaccination. The scale up from 2 to 2,600 RT-PCR labs in close to 4 or 5 months. That's the scale up of testing. Of course, as the epidemic evolves, the pandemic is evolving, you change your testing strategy. And the country was doing that as the waves were coming in. And lastly, the operational guidelines for this vaccination was also as agile. It had several versions. I've seen many versions of those being tweaked towards the situation in the different states. So to your question is related to a whole ecosystem of product research, rollout, and evidence. So I gave you a very complex answer, but it's something to watch out for.
Can I ask whether the quality of the vaccine in different, whether it's a local research or imported, the AstraZeneca and so on, are they be able to deal with the next wave and the wave after, or they're being developed as we move along in India?
So as of now, as per evidence, the vaccines that are available can deal with the virus and all of its variants.
Okay.
As the Alpha variant is in 193 countries, Delta is in 186, both of which we know that are more susceptible. So even with that, even if we had the vaccine, the key thing is still to be able to prevent the third wave. This is where I'm coming from. We can prepare for it, but you can prevent the third wave as well. And it's really messaging. It's really bringing people to the response. It's not always in the hands of government, of experts, of virologists, or manufacturers of vaccines. It's with people. So if it's 3 Ws, it's to wear your mask, wash your hands, and watch your distance. Can you imagine how much you'll be able to prevent for this? And of course, ventilation, and in that background, vaccinate, vaccinate, vaccinate. That's how to increase the immunity of the community, so to speak. So I think that's where this really is headed towards. That's where the evidence is. These are being reviewed in terms of the studies that are being submitted to the global body of knowledge, whether it's in different journals, and that's also what our organization globally does.
Thank you. Syed, can I ask something on the economy? It's India is now adapting, like you must live with the COVID, and how's the economy moving and unlocked in different states? Are there equality nationally, or they move as they experience individual states?
No, I think it has been a disastrous for the economy, for global economy for that matter. I think every segment of industry has suffered badly. You can just imagine there are thousands and thousands of companies which were shut down, millions have lost jobs. We have seen the young workers leaving, migrating back to their homes, and we have seen educational institutes really badly affected, still closed after almost 2 years. We have seen tourism industry badly suffered actually. So I think there's a global story, but I think because India's GDP was doing exceptionally well before the COVID hit actually, so it was an extremely bad timing for the overall economy. But what we have seen in the last, since the vaccination rate is improving, more people are getting vaccinated. I think in most of cities now, even including in Delhi where I'm based, so markets are open, people are going to jobs. There are no restrictions, metros are on, airports are running. So I think the lot of market is slowly reviving back. And I think the last final decision perhaps is about the schools getting reopened, and there have been states which are trying to implement a phased manner, a plan in which they will allow schools to come back and kids to come back to schools. And we are seeing, the transportation industry is somehow back to normal kind of thing. But I think given the, that's an Indian story to a larger global, economy fora, is that given the demand inside the country for everything, so the recovery looks quite possible, and quite, if things improve in next 5-6 months and vaccination, we go like right now we are like almost 70% adults are vaccinated with one dose, and we have almost 18% of population which has been completely vaccinated with 2 doses. So if this rate increases by the end of this year, that will also increase the confidence of people of going around traveling, because it certainly makes a huge difference. Like in our office, for example, we all are coming office now, and all of our staff is fully vaccinated. So, and we take our precautions, we wear masks when we come here, we take social distance and all, but the work has not really suffered that way. The work has somehow reconnected, and we have been able to do our bit of work. So I think for Indian economy, the actually huge thing will be when we are really improving it's a proportional. So the more vaccinated people, the more vaccinated people are available for our work. So, and given the demand which is in the country, there is a strong possibility. I think that's also the assessment of the World Bank. The economy will recover as soon as we hit more numbers in terms of vaccination. But overall, if you ask me, it has been extremely, extremely bad for Indian growth story. We really have come down from the projections where we were 2 years before.
Lots of questions from the audience. Maybe I can go to Akasha to answer.
Yeah. Question is for Mr. Nazakat. I'll go ahead with him. In April and May, when India was in terrible grip of the second wave, Anthony Fauci said India opened up too soon. Is that valid today too? Someone has asked from the audience.
No, I think Mr. Amrit will be a better person to ask that, like given that experience. But I think there was a lot of learning. I think there's no doubt about it. There was a lot of learning about how we dealt with the virus. I think to be honest, like it was like the virus also changed, its nature, and we have even today we really do not know about the third wave. And we're quite surprised looking at the situation in Kerala, that we thought like Kerala was exceptionally doing well, but then it's really hit quite badly, and which is like to us quite surprising again. So I think it's a lot of learning for sure. There were bad decisions as well. So nobody would say there were no bad decisions. There were bad decisions. Maybe timing was wrong somehow at some places. But I think I will leave it to Mr. Amrit to kind of do a better answer.
Yes, Mr. Amrit, please.
I would just like to say a few things here. See, any decision which we take, it has its pros and cons. We must understand one thing: all the unlocking, every state, had a committee, and every decision was a well thought of one. You see, we must understand the stage has come where on the one hand, we are stepping up our vaccination and we are stepping up our testing, and the basic infrastructure gradually is falling in place. Then we must, start believing one thing, that life must go on. We must learn to live with Corona. You can't have children not attending schools for 1 year. You can't have your entire economy in shambles. It's a risk, I do admit, but we have to. After all, life must move on. Individually, the number of cases, of depression, traumatic experiences, economy, children, overall. And then that's how we took the decision of unlocking. I remember the first unlocking in Bihar we did in the month of June. Once we saw our active cases coming down to 800, 700, 400, we were also changing our policies. And the last one we have done is the mother of all festival in this part of the world. And in India, of course, is the Shahra. But for Bihar is Chhat, where we not only worship the rising sun, but we also worship the setting sun. And all over the world, people from this part of the country, wherever they are, they believe in this. It's a very, very big festival. Now, coming to the festival, we have what we have allowed is the festival, the entire thing, the setup is going to be there. But all the organizers have to give a certificate to the effect that they have taken both the doses. Our vaccination teams are going to be right there at the entrance gate. Testing team is also going to be there. So we are taking adequate precautions in our schools. Random testing is going on. I'm happy to tell you, children, I've been traveling a lot. I see children going to school with masks. So therefore, the time has come where we must learn to live with Corona. Life must go on. We should never lower our guards. And just to add to what Dr. Offren said, it's test, track, treat, COVID appropriate behavior, and vaccination. These are 5 strategies of India. And, we are following this, we are working on it. And therefore, I don't think so that if somebody says that we have opened it up a bit early, no, it's a well thought of strategy. And whether it's Government of India or the various provinces, we are all in sync. In Kerala, for instance, in state of Kerala, which he was talking about, when the cases started moving up, all the trains and flights from Kerala, which were going, at least in our state, and I saw in other states also, we made it mandatory for these vaccination reports and RT-PCR reports. People coming from those parts, we started quarantining them, just an order, the 7 days. So these are some of the steps which we learned. Very rightly, he has said, it has been a great learning experience for all of us. And let's see how we evolve further. So therefore, as on date, it's a well thought of strategy. And at the same time, we have prepared ourselves for, and we are still preparing. I mean, nobody can be confident. Nobody can say that, we can take this disease head on and we are all set for it. But for the best, eventuality also, we are now gearing up. So therefore, that's one of the reasons why a lot of activities have opened up, not all. Still, there are a lot of restrictions in this state. Still, we have a lot of restrictions. We have not opened up completely. That's all. Thank you.
One more question, Mr. Amit. It's from audience only. Is there vaccine hesitance in rural Bihar still? Can it affect the response to the pandemic?
It's a very pertinent and a very valid, very good question, because this is something which really hit us in the initial phases, and quite understandably so. See, when in urban areas, as I mentioned, I took the first shot myself, just to inspire confidence amongst our healthcare workers, that if I can take the shot, then it should not be a problem for others. So therefore, you can imagine the level of hesitancy, and thanks to the social media propaganda and all kind of things. And the worst was this rumor kind of a thing that somebody X got a vaccine and that person passed away. So all combined, it was a very difficult task for us. And how we tackled it, I would like to share this. in Bihar, we have different geographies. So we realized in certain pocket, it has got something to do with religion aspect also. So we met these religious leaders. We took them on board, and I'm so happy to tell they led from the front, these religious leaders. And we had a constant dialogue with them. And these religious leaders, in turn, started giving message to the communities that it is safe. If you want to be safe, your family to be safe, there is no harm, go and get yourself vaccinated. So we used the religious leaders. Second, and very important, that was the time when this part of country is ravaged by floods, ravaged. And we converted this crisis into a huge opportunity. All the teams which were evacuating these people to the camps, we made it mandatory that you will be vaccinated. Now, in that period of crisis, a lot of these people, when they were being evacuated, when they were being kept in the camps, we made this vaccination easy for them. And then they started, realizing that it's nothing, to be worried about. Then when we were running our community kitchens for these people, a lot of people, they don't come to camps. They are very hesitant. They want to stay back in their homes. So we have a system of running community kitchens for them, where they can come and have 3 meals a day and go back to their places. So in these community kitchens also, we made special arrangement for vaccination and testing also. So therefore, that's how, and then over a period of time, the last stroke what we played was, we made it mandatory. If you want to avail of any government facility or scheme in rural areas, that includes your free ration and so many other benefits which government in India gives. And in our state, we also give. We made it mandatory that you have to have, first dose of vaccination, and you show us thanks to this COVID portal in India, which is a very robust system, very well, structured COVID portal, where, you can easily get all the information what you want. You can, in case of some mistakes, you can correct it also. So a good amount of, technological innovation has also been done in India. And we are really grateful to Government of India for this beautiful innovation that is helping us. If you want to know how much a state has vaccinated by 2015, we can immediately get the figure real time. So all of us, we are into a very healthy competition between the various provinces, and we compete in a very healthy manner, because ultimately the country has to win. And if, the country wins, and, overall, if people are safe, that is what matters. So for vaccine hesitancy, use of religious leaders, constant communication, what Saeed Nazakat was mentioning about, social media we used effectively. We used our elected leaders. We are having our grassroots local self-government elections going on in Bihar. We have made it mandatory for any candidate who desires to contest, he has to show that he is vaccinated. So what has happened, when we go for our mega vaccination camps, there is a competition amongst the candidates to get their voters vaccinated. So we are using all this, and we have converted crisis into opportunity. And the net result is that we are surging ahead.
Yeah, very innovative. Dr. Offrin, there's a question for you asking about why is there uproar over the quality of Indian vaccine for Indian people going overseas? If you could explain this.
Not so clear of the question in terms of the uproar. I think it's just at present there are only a few vaccines, COVID vaccines that are WHO emergency use listing approved. Now, it is not our recommendation that a vaccination is essential for you to travel, except that many countries have. It might be better to have really a negative RT-PCR. Even if you're vaccinated, you may carry the virus, as we all know, or even get at least might be sick from it. So maybe that's where this question is coming from. The Covishield is AstraZeneca, and that's already WHO EUL approved. It's the other vaccine that's not. Yeah.
Okay. All right. Okay.
Dr. Offren, my question is it a good idea for India to resume vaccine export? Would you say the country is out of the woods? Someone has asked. Yeah.
I will never predict everything that has been predicted or even mathematically modeled around this pandemic has not served us very well. What served us very well is actually the basics of public health: test, trace, treat, COVID-appropriate behaviors, and vaccination. Now, the question, I think I already answered that bit in terms of the export of when it will happen. As I said, it's a more complex decision than just coverage. It's other things as well. So I think I'll just wait for government to be able to take a call on that based on the evidence and the trends that are that we're seeing.
This I could ask Mr. Amrit. Do you think the export will resume soon from your state, or you think you still need lots of vaccine for the local population?
I think Dr. Offren has really summed up this answer very well. But all I can tell you is, India, we believe in Vasudhaiv Kutumbakam. What it means is universal brotherhood. So I'm sure we'll be extremely happy the way our country is progressing at the moment and the way we are moving very close to our target. And let's keep our fingers crossed. And I will not be surprised if we'll hear something positive on this front very soon.
Mm-hmm. Okay, all right. Akashanta,
yeah. Is there be need of third dose once community are saturated with both doses? Yeah, will there be need for third dose after having 2 doses of the vaccination of Covishield? Will there be there comes a time when we'll be needing the third dose? Yeah, that's the question.
Shall I try and take that?
Please.
Well, practically the second dose is already a booster dose because your first dose of the vaccine actually tries and stimulates an immune response for which your body will react once the virus comes. So it's still very difficult to have a very general question and an answer to, do we need a third dose? If everyone does their part, for example, in terms of being able to prevent this, then with appropriate behavior, with voluntary vaccination, then there may not be. I am not sure yet how this will evolve. As you know, the more you transmit the virus, there is an opportunity for it to mutate, to create a new variant. And that's what we don't want. That's what we need to stop. If it's happening elsewhere in the world, we are just as at risk. The statement that no one is safe until everyone is safe is that. It's not because it will be able to cover all for vaccination, they will be safer, but who knows what in another country, if things continue to transmit and how a variant develops, it will also still put us at risk. And as mentioned by Mr. Amrit, it's really it's a call for the world to help each other. India has that in its Vedic philosophy, but it's also an idea of sharing doses, sharing resources. And so maybe I'll just get into this right now. COVAX is a facility for which countries donate funds for vaccines or shared doses for. There is another group that is also looking at technology sharing. It should not be as a public health emergency. The biggest so far in our lives is that countries or manufacturers, scientists should waive some of these IPRs, the intellectual property rights, to be able to, for many countries to be able to also manage their own manufacturing. So there are certain hubs. WHO is facilitating some of these technology transfers. So it's still at a large, although your questions are specific to India, let's also see it largely still as a global crisis. Thank you.
Thank you. Thank you. We're running out of time. Maybe I use my privilege to ask you, each of you, one last question each. Perhaps I could start with Mr. Offrin. For country, poorer countries, very those African countries and so on, which are not so good health. What are 2 or 3 things that are essential for them to move forward and deal with the COVID that you see from where you are and your experience regionally?
Well, the first thing is to really rely on people, engage communities, engage the population to be able to fight the pandemic with you. No amount of vaccines will be able to cut transmission if no one wants to wear a mask or wash their hands in the interim. And as the transmission continues, the pandemic continues to be complex. So that's one. Engage people, communicate with them well, so that they become your amplifiers for healthy action. 2 is really to look at information. Apart from healthy behavior, it is an individual's responsibility as well to screen the information that they get. There is so much that goes around your WhatsApp, your Facebook, even just a group of friends telling you that, no, I'm not taking that because of some other belief that what the vaccine may give you, or what a possible drug can cure COVID, for example. So make sure that you're also responsible. It's really looking at people. Don't forget that with public health is the public. It's not really resources for everything to be given. Of course, at the end of the day, it's really a system in which you're able to vaccinate. I think that's as per our topic. With those 3, you'll be able to have an environment that you can vaccinate, and do this fast. So it's a system. And think of it as not how do you say, a new input, a new investment. Think of it as an investment that will have a legacy for future diseases, that are vaccine preventable. So everything is towards the response of countries should be, as what we're seeing here in India, is towards a more resilient system, a more prepared system. So it's a prepared ecosystem from development of a vaccine to rollout, testing, etc., and manufacturing. It's from research and development to product, from setting up systems for rumor monitoring and delivering the right message. Who are the right channels everywhere? It's different everywhere. So it's really creating now a system that makes you prepared as you respond. What will this be 5-10 years from now for the next disease? And as I always say, a prepared India is a prepared world. See, everyone is looking at India because of its successes in vaccination. And for any future event, that will be the same.
Thank you. Thank you. Syed, technology plays an important role in this crisis. What technology impressed you most that you scanned through?
I will certainly say it's so fundamental to pay more attention to health data actually, and collect it timely, use it for better understanding and interventions. Because what we also learn actually over the years, we lose a lot of data in the practice actually, and then sometimes we really feel lost how to intervene. So I think particularly with this whole exercise, for example, COVID and another platform where we have the data, it's remarkable insight actually. What is happening? How many people are getting vaccinated? Why are less women getting vaccinated than men, for example? And which are the hotspots and all. So I think data will play a fundamental role in the public health, and it has been always a backbone. And I think given the way the technologies can help us with machine learning and predicting a lot of things for the future. So I think this whole investment into technology, particularly in the current phase, like I was reading a news article yesterday in one of the Indian states, we're using drones to for a delivery of vaccines. So there's a lot of innovation. But I will also come back to one point which Dr. Offren said, which is very close to my heart, and I've spent a lot of time on that, is actually health literacy. I think a lot of things can be improved if we improve the health literacy in our communities. Prevention of the diseases, like very basic, simple things, and helping them understand the problem of misinformation, which is going to be bigger and bigger challenge moving ahead, actually. So I think these two things, I see use of data, collection of data, analysis of data, and timely analysis of data, using that for decision making, and improving your health literacy campaigns as well, empowering people to understand what is a scientific claim and what is a non-scientific claim, and what is the difference between in somebody's opinion and on facts on the ground. I think if we pay attention to these two things, it will certainly empower community. And this is a global phenomenon. I don't think it's like limited to India. I think it's same everywhere. If we improve health communication, health literacy, usage of data, that will fundamentally empower us.
Okay, Ms. Amrit, last but not least, a question from you. After all this, what lesson you think that Bihar itself with 120 million population can learn and then become a more thriving, less poorer, a more richer state of India? What do you think it would be the factor that you learn from all this and then to move forward?
First and foremost would be, the public health investment. This must increase substantially. And that's what we are basically working on right now. And one of the recommendations of Niti Aayog, this is an advisory body for this country, tells that 8% of the total budget, which every state government has, should, our health budget should not be less than 8% of that. So that's first thing. Second is the time has come, we are going into a national digital health mission mode now. Now it is more of digitization. See, challenges like shortage of resources, whether it comes to doctor, paramedics, and other things, those challenges are there. We have to address that. But at the same time, to overcome these challenges, instruments like telemedicine, the way we are using it now in this state, we started telemedicine on 21st February this year in the state, and we are getting very good response. And very soon we'll have these specialist doctors also on that panel. So it has to be a mix of public health investment, which means the basic infrastructures, which must be in place, the human resources, technology has to play a very big role now. You see, smartphones, 90% people in this part of the world, they have smartphones. And the way they respond, most of these DBTs are happening in India thanks to the smartphones. So what I see is in Bihar, we'll not have to go gradually, but we'll have to leapfrog if we want to be in that same level as some most developed states like Kerala and Maharashtra and other states. So what we are now planning is something which we can leapfrog with, and that's what the policy we are presently working on.
Thank you very much. On behalf of the organizer, the Statesman, Asia News Network, and Data Leads, I would like to thank all the speakers in sharing your experience, your analysis, your vision. I think we learned a lot today. I think many of the information are useful for many countries looking, and we hope, I think we all hope that the export of the vaccine from India will be resumed soon, so that you can play a rightful role in the world alliances. Thank you very much, and have a nice day. Thank you.
Thank you so
very
much.
much.
Thank you so much.
Thank you, the audience, for staying with us throughout. Thank you. Bye.